friend here and fellow board member, Dr. Wassett. So first of all, Panhandle Health District covers, Asia, can you tell me the whole?
Top 5 northern counties.
Yep. Okay. Friend here. Did I say that?
No, it was someone online
Oh, hi,
who
guys.
didn't mute themselves. Jessica
Hello.
Fry, maybe.
Okay, so a couple of things that Katie couldn't be here today. So she asked me to talk to you a little bit about what Panhandle Health District is up to. So first of all, Tamarack is their outpatient substance abuse center, I guess, and they have services and counseling for people that are struggling or coming in and out of drug court, I guess. PhD also is working with an opioid settlement fund to provide sources to all 5 counties through programs such as Panhandle Health District, 5 counties through programs such as medication lockboxes and medication disposal pouches. So that's kind of cool. And the counties that they have right now, I'm not sure what they have right now, but they do have also Narcan trainings for community members and organizations. Everybody know what Narcan is, right? Help?
No.
Nope.
No. Yeah.
Narcan is a reversal for morphine-like substances like fentanyl, the big word of the century, probably.
So is that injection?
It's intranasal, I think, is what they're doing over the counter, but in veterinary medicine, we have it as an IV so that if we have an overdose, we can just right in there. So the fentanyl is 5 times stronger than, y'all know this probably, but it's 5 times stronger than morphine. And morphine is really amazing, right? So if you can think of, it's just so powerful. And what's happening is that when they put stuff in the non-prescription drugs that are going out to everyone who's in trauma, they're putting the wrong doses in because it's like 0.00 something, per kilogram, right? So of course, if you're doing the math wrong, you're going to kill somebody. And that's pretty much the short story of what's happening, besides the other things that happen with overdoses. That's a problem. And so Narcan, it'll reverse it in a second. And so these Narcans, everybody should have it in their car because you don't know who's going to be suffering next, right? So they're trying to make it accessible for everyone. And they're actually having trainings now for community members like us and organizations so that we can give it to people and have it to be able to reverse someone that's struggling. And
I'm going to jump in here and add, since you did a little bit on the fentanyl, the other issue with fentanyl is that if you touch it, you can actually have a reaction to having actually touched it. So you have varying doses. It first came in the medical community as a transdermal patch where you're just wearing it. So you imagine police officers, even with rubber gloves, going through items and touching fentanyl, you can actually have a negative reaction just from that. That's what makes it so lethal in the community, is you don't know what it is until you have the reaction.
Should all of our law enforcement here in the county carry it in their cars?
yes.
Yes.
Yeah, I know. I think I would urge you to get online and look at some of the fentanyl statistics. It's a pretty big epidemic.
We will have this discussion in March because ISB is going to come back and do a fentanyl education for a commissioner chat.
Right. Good. Okay. So then there's, ooh. What's this say? Oh, they're trying to sell. So there's 2 Narcan vending machines now in 2 counties, the ones with the highest overdoses. They're Shoshone and Kootenai, and they're trying to get them into the 5 counties now. So that's what Panhandle Health District, they have their hands full. I'm going to turn this over to Dr. Wassef, Dr. Joe Wassef, and let him introduce himself. He's got quite a long bio.
Oh, thanks. Thanks, Don. Can you all hear me through this, or do I need to?
Nope.
It's WASSIF. Yeah. Yeah, Wassef. I'm Joe Wassef. I am what's called a prescribing psychologist. And what that means is I had my doctorate, was doing traditional counseling, and eventually transitioned into doing neuropsych testing for multiple years, and lived in the community for the past 9 years. So I don't know at what point you can actually call yourself a local. I don't think I've crossed that bridge yet, but you all can let me know. But I've been here for a number of years. I see some nods. I appreciate that. And been at Bonner General Hospital actually for the past 6 years. And so I've worked there at Bonner General Behavioral Health. And then 10 days ago, today is day 10 for me. So be kind to me. There's a lot of I don't knows here still, but became the director of psychiatry at Kinixu, because I went back to school about 5 years ago and got an additional degree in what's called clinical psychopharmacology. So you have to have a doctorate before you can go back to school to get this additional degree to prescribe medications. So that's the hat I wear right now at Kinixu. Love it. But if you ask a lot of very detailed questions about Kinixu right now, I may not know the answer, but I'll do my very best. But I just want to say thanks to Ms. Williams to hosting. Anytime we get a chance to interface with the community about mental health and what's going on, providing updates about what services are available as well as what's not available, I think that's an important topic so that we can keep people as healthy as we possibly can. So I'm happy to answer questions broadly about the state of mental health services here in Sandpoint, at least from one person's lens, but also provide some details about Bonner General as well as Kinixu.
How about you tell us what services are available?
Sure, yeah. Just broadly, or wait, here, I'll start with Kinixu because I can give those specific answers. We currently have 7 therapists, mental health therapists, serving the community at BGH. We're serving at Kinixu, serving all populations, all insurances, and that's one of the things that I really value about Kinixu. Sliding scales, the pharmacy, we're able to serve folks of all insurances, all capabilities, all backgrounds, and it really doesn't matter where you come into the program. We'll be able to get you some help, and that's one of the things I really love about it. There's 3 psychiatric providers, including myself, 2 psychiatric nurse practitioners, and then myself, and we're continuously talking about how we're going to expand mental health services for the community. But again, I don't have a lot of details about what exactly that's going to look like in the coming year, but that's our hope.
I'm going to give you a little bit more in-depth one, I guess, then. What
Sure.
about, because we have a member
Yeah.
of our West Bonner County School Board here, and one of the questions is about what do we have in terms of services for suicide prevention for our youth in Bonner area?
Yeah, I wish I don't know if Joy's listening in, Joy Jansen, or not, but you didn't see her yet. She would actually be one of the best people to answer that question, because she's developed a program that I know is being implemented in the school system. I can't tell you the name of it off the top of my
You
head.
can give me her contact and I'll tag her next. time.
Okay, great. Yeah, she would be. I I don't want to volunteer somebody, but I think she would be at least a great resource, and developed a program about introducing this topic, exactly, giving people the language to be able to have some really hard conversations, encouraging parents. You had your hands up, sir.
Yeah, I've been here many years, whatever, but I guess I'm disattached.
Yeah.
So I'm familiar with the hospital here,
Yeah.
Bonner County Hospital, whatever. it's
Yep,
called.
BGH, yeah.
But when you say Kinixu, whatever,
Yeah.
I don't know anything. I know that name, but I
Yeah.
don't know about Kinixu.
Okay, well, let me Yeah, I think it's a great question. Thanks so much for asking it. So, no, it's not attached to the hospital. It's not a hospital. It's a community health clinic, right? So there's the services that they provide in Sandpoint. Yeah. So do you know where Super One is over, just Larch Street? So I bet you've passed it gobs of times you didn't even know, right? So it's the new looking building right across the parking lot for Super One. So if you were at the front doors of Super One and you just turn your head to the right, that's the building, right? Yep. It's a really great question. So it makes me, backtrack here a little bit. So dentistry, pediatric physicians, family practice, and behavioral health are the four big prongs that we offer. And then internally, there's several services that exist, like case management, things along those lines that are accessed once you're established at Kinnicksu. Yeah. Yeah, it's a very large practice, medical and psychiatric. That you're now telling me we need to get that name out there a little bit more so folks know who we are, because it's a very large entity. Hundreds of people work there. So yeah. And let me also add that there are outpatient clinics also at Priest River and up in Bonners Ferry. So there's 3 different practices, with the largest being at Sandpoint.
So, yeah, and the cool thing about Kinnicksu that he already mentioned is that they take Medicaid and, well, any income level, even if you don't have Medicaid, I believe they take.
Yeah.
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 So that's very, very important for everyone to know about. All right. Any more questions for Joe?
All right.
Well,
Go ahead.
so yeah, this is highly appreciative from my personal here. I had a brother a few years younger than me, a number of years ago, that came up here, and he was injured badly in a traffic accident, pedestrian and vehicle, whatever. He was the pedestrian, and he recuperated through a horrible accident or whatever, but then he had mental issues then after the recovery because of a head injury.
Yeah.
And he did end up committing suicide down the line or whatever, but there were many areas of help, not only physically in the hospital, but mentally after the fact, that where I became highly attuned to what all was out there for people that get caught in scenarios like this, me included, or whatever, as per, being connected to him.
Right.
And so highly, highly appreciative of the sources and the work, whatever that is out there, whatever, for people that do get caught in these dire scenarios. So I thank you.
Yeah. Thanks so much. Yeah. There's a hand back there.
Are there behavioral health services there in Priest River at the Priest River's facility as well, or do they have to travel?
Yeah, there is a therapist, and actually one of our psychiatric providers goes there every Thursday, and that she spends all day Thursday providing medication management psychiatry.
Is there an age group, ages from teenagers, young people, all the way up to older people? Because like Kevin was saying over here, I think it's Kevin. There, I have a son-in-law who'd suffered an accident, and I am seriously wondering if that's maybe something that's going on with him in his post-recovery. But an age group would be real nice. I mean, I know it's on a sliding fee. I'm kind of familiar with that.
Yeah.
But what is the age group?
Yeah. So I can tell you my caseload. My youngest, I can't remember if he's turned 6 yet or not. So 5 or 6. So and remember, we have pediatricians, right? So we're constantly interfacing with primary care. So if there's a question that we might have, we just walk down the hall and say, "Hey, Tammy, can you come in and say hi to this patient?" This actually happened yesterday, and that's one of the great things about working with an integrative care unit is you just can walk down the hall and have multiple different providers be able to help out. So my youngest is 5 or 6, and then my oldest patient, I believe, is 89. And then the lady that goes out to Priest River, Heather Huff, she primarily sees pediatric patients. So under the age of 18. I couldn't tell you what her youngest is right now, but probably pretty young. Yeah.
Okay, thank you. So
Wanna
I want to
talk
make
about what
sure,
you offer? Okay.
I want to make sure you get to go through the NAMI
Yeah.
spreadsheet and
This
the
is pretty
clubhouse.
short, so
Well, so I serve on the NAMI board. I don't want to let Don
Yeah.
get away from
credentials up
this.
there
So
in a minute.
she's amazing, right? I'm here, but, mostly just to fill time because the big, the big,
No, he
information here
serves so many
Don.
people.
So here's just one thing I will say. Yeah, I'm happy to talk about Connexio. I'm happy to talk about BGH and the services. But what's exciting about what's going on with NAMI right now is they're starting to fill a gap, right? Because one of the things that I see readily is what we don't have, and that's a diversity of services. We have an ever number growing of outpatient individuals serving as counselors and psychiatric providers. That's on the grow, and I'm excited about that. We're not there yet. By no means do I think we've hit saturation. We still need more therapists. We still need more psychiatric providers. But what we don't have is levels of care, right? When somebody, if they need psychiatric hospitalization, when they discharge, all we have is outpatient care, right? And I think our therapists are doing their very best by offering maybe like when possible 2 appointments per week, but that's not something like an intensive outpatient partial hospitalization or services like NAMI's, which is not clinical, but a space to help folks that need something beyond just once a week counseling or once a month psychiatry or something along those lines. And that's what's really exciting about being a part of NAMI Far North is they're seeing what's available and starting to have some conversations about what is needed. How do we fill that niche? So I hope that tees you up a little bit there, Don. Go ahead.
If you need to leave too, you can.
Oh, I'm okay right now. Thanks.
All right. Okay. Well, there you have me in my glory. Before we talk about NAMI though, I wanted to ask you guys a little question. What do you need for your life to be meaningful? This is simple answers will do.
Joy.
Right. Security. Okay. What about friends?
Yeah. Yeah.
Psychological help. Yeah.
Yeah.
Psychiatrist.
Yeah.
Yeah. So people, right? People and family connection. It's like attachment is a big human need. The security, the place, right? And purpose. Nobody mentioned that, but it really does help when we have something to work towards or live for. And this is what we decided to talk about today is getting, well, not today, for the next 3 years, people, place, and purpose for some people that are not, their needs aren't being met. And here's the deal, like think about if you didn't have your people, just missing one of those ingredients is really harmful to your human essence, right? So some of these people that are living with mental health conditions don't have any, they don't have all 3. So that's where we talk about the National Alliance on Mental Illness. And we are the largest grassroots mental health organization in the United States. We have over 1,000 affiliates, which means that we're everywhere in 50 states. Our mission statement is similar to the NAMI national mission statement. It's education for families, for people that live with mental health conditions, support for both of those as well, and advocacy and awareness. Most of the advocacy is done in Boise, but we did write a letter this year because we knew what was happening in January. So small boxes, but a big job. There's so much we can do, right, with those boxes. As far as how I got here, my son, he's living a normal life, right? And then all of a sudden, boom, everything changed. By 19, he had, we got a call that he was in a psychological break from reality. He had been playing hockey in Victoria, BC, and came down with, I don't know what had happened, but just a lot of stress, the stress of maybe playing the hockey and then a little genetics or something else. But our life changed, and reality was pretty grim. It was like a 90-degree turn, or maybe 180, all the way back to we have a chronically ill person in our family now. And about 11 years of in and out of hospitalizations, trying to figure out what's going on, using people like Dr. Wasif and Rand. And I don't know, we just went everywhere trying to figure it out. But we found NAMI in between it all. And during his time, this 10 years, NAMI was here to support and educate us. And, you know, he eventually recovered. But NAMI really helped us. I get really emotional about this because we were so isolated. We didn't have any, our friend group was different because they had these kids that were doing normal things now, and we were still stuck in this, you know, getting him better phase where he's still 19 emotionally. Everybody else is getting married. So the NAMI group really understood that, and we didn't feel as alone. Okay. So now I'm the president, and I'm able to help other people get past some of the stuff that happens when you have someone with chronic illness in your family. Or if you do have chronic illness, we also mentor them. So what happened is that we didn't really have a place for him to go after he was treated from the hospital in Orfino. We did have some people that helped us along the way, of course, but we had to hire them all. And we didn't really have the resources to do what we needed to do. So that's why we decided when I became president a couple of years ago, we thought about what kind of project could we do for NAMI? And I will talk to you a little bit about it. There's our family. But first, let me tell you about our board of directors. So I'm on top, which anybody can have this position if they want. Catherine Peruse, I don't know if anyone knows her, but we've got lots of good mental health knowledge people on our board. We also have people that live with mental illness on our board. That's very important to NAMI, that we have members on every committee because they have that lived experience of what they're going through. Then we have Dr. Wasif, we have Dr. Schmidt, who is a suicide person in the county for quite a couple of years here. Cindy Hall, we've got a retired law enforcement, Kimberly Kempton, Steve Klatt. He's been around this area for a long time. He's a family representative as well. And Deb Osborne just joined us as a board member. She's also a a licensed clinical social worker, counselor. And then we wanted to back up a little. I want to back up a little bit because not everybody knows that 1 in 5 people can live with a mental health condition. And we call them any mental illness. So a little depression, anxiety, or big depression, anxiety, right? So there's big range. And that's 1 in 5. That's 20%. That's a lot of people. We all know someone or us that has had some struggles. With NAMI, we deal with the 1 in 20, and those are the serious mental illnesses that are like schizophrenia, bipolar disease, serious anxiety disorder. I know that a lot of people know what it's like when you really have anxiety. It affects your function, and the way that you live your life is completely different than the way you used to live it without that condition. So the 1 in 20 is a lot of people. If you think about it, let me tell you the numbers. Look at this. This is potentially 3,900 people that in these 2 counties that live with a mental health condition like these serious ones, right? That's a lot. So that's when we started our project on maybe getting some help for them to get their people in place and purpose together. The thing about mental illness is that it's different than a developmental disability where there's a ceiling of recovery. With serious mental illness, depending on what you have, most people can resume a life that has people, place, and purpose in it, and recovery is possible. But you do have to have treatment. And the people that you see out on the street, maybe they're not able to get treatment for whatever reason, but you don't see the people that have recovered. They're walking around like you or me, not telling you that they live with schizophrenia. So you just don't see them as often. And here is what Joe is talking about is the history of mental health care and what we've taken out. So back in the 1800s, we would put Aunt Sally in the attic, right? They would just stay up there hidden away or in an institution. And back in the 60s, I think JFK, we got them out and we started doing really good things in the 60s and 70s. We had community outpatient care like what we're missing right now. But then in the 80s, we have so many cuts. Everything's cut. And now we're free to be homeless or maybe even in jail, right? Most of these people land in jail because they cannot get rid of their psychosis or delusions and they get into trouble. And they're warehousing on the street, really, or in jail. And when we have these healthcare systems that fail, our recovery really stops. And that's just so wrong. So here we have this like interruption and social and economic isolation. We've lost our people, place, and purpose, our connections. And we have all of these shortages of beds. And I know you guys have heard of all these things that we can't get a bed in Orfino. We have to wait 3 weeks. We've got it 3 days in Bonner General. But if you get treatment, if you're lucky enough, like my son was lucky enough to get some treatment, then you have like, what now? How do we replace this people, place, and purpose thing? Well, you need mental therapy. You got to have a place where people can go, and there's sophisticated places all over the states, depends on what color your state is, right? Where you can go and do some outpatient stuff, like every day you walk in and you have something going on for you, and there's no stigma or discrimination. The thing about mental therapy, which we call psychosocial rehabilitation, is that it takes a lot longer than a broken arm to heal a brain. As we all know, if you have relatives or anybody with a TBI, a traumatic brain injury, it can take years, months to years, right, to heal. That doesn't happen 2 times a week in a counselor's office. So how do we restore function? How do we create social connection, housing access, meaningful work, independence, education, vocational training? It all has to do with rewiring. So we were thinking, okay, this is a major gap. It's something we can do in this county. Why don't we find a model that we could maybe base our project after? And we found Clubhouse International. They have 340 clubhouses in more than 30 countries, 37 actually. And what they do at Clubhouse is pretty similar to community-based resource work. In when you have a counselor and then they'll give you someone to hang out with for a little while and go play tennis or whatever. Supportive, inclusive. There's no hierarchy in these clubhouses. The members and staff work together. And there's also this fostering of relationships through work and a belief that everybody has the potential to recover. That's huge. What doesn't happen? He's not there. There's no clinical treatment facility. There isn't a psychiatric environment there at all. But it's really not a pull hall. We're going to do a lot of work related things in Clubhouse. So Magnolia Clubhouse is, this is a member testimonial, and I unfortunately can't play it today because I didn't tell Jason soon enough. But the members love this place, and we're going to have a fundraiser, a friend raiser, let's say, but it's coming up next week, and we'll have some people from Clubhouse coming up from Spokane.
And our clubhouse is in Sandpoint.
Well, it will be.
That's where you?
Yes.
I don't want to advance you, but.
I'm getting to that right now. So just let me tell you, so it's data driven and we have ready-made programs and a proven track record. This is Clubhouse International, the model that we're going to be following. And the reason they work so well is because there's 37 standards and they're based on research that provides the best possible outcomes. They actually, the reason there's another reason that they're super successful is because they base every member has a work order day. And so they believe that you can build your relationships on this work order day. So when you come in to the facility, it's like you're either making lunch, you're picking up people, or you're working on with vocational rehab, or you're doing something. It depends on your level of recovery, what you want to do, but you're going to be working, right? And that's how we build relationships. So the evidence base behind Clubhouse International is truly phenomenal. And this is what nailed us. This is the Kool-Aid right here, is that the higher rates of employment are 42% versus 25 for a regular clubhouse or maybe a national standard of recovery with or without a clubhouse. But 42% means half of those people go back to work in some capacity. And all the other ones you can imagine would happen, like decrease in hospitalizations, decrease, jail time, less disconnectedness. And of course, when you get to the bottom, it's cost effective to keep people working and out of jail. But compared to other clubhouses, this particular Clubhouse International is cost effective. You can't see the slide, but it's half the cost of other ones. So what we're looking for right now are people like you, partners, to help us launch this thing. And our mission is to provide this recovery-based program for individuals living, and it's actually also in a facility, right? Facility for people living with mental health conditions of the kind that I talked about earlier, the SMI, the serious mental illnesses, to build meaningful relationships and find fulfillment through working and engaging in their community. So these people would be donors, advisors, volunteers, and we actually are in the process of getting off the ground and launching it. So we would love to have some founders for that heavy lift. The financial part of it is sticky because we have NAMI Far North assistance. We've got grants, individual donors. We do have collaboration with the community health center as far as on a very, they're very interested in using us, I think, for feeding us. And that will be really good for our members to have. I'll take questions in a minute because I'm gonna be finished in a minute here, but the initial startup is the biggest part of it. And one thing that I want to tell you is that 7 of us have trained for over 17 hours. We spend every 2 weeks actually after our December training doing all of this planning and getting it organized. So they're going to, at Clubhouse International, support and mentorship for us for up to a year. They'll probably do lifetime. They're very cool. They want this to happen here. And then we have the support of NAMI. We've got Coeur d'Alene, Idaho State, NAMIs, and then lots of nonprofits have been really interested in being our partner. And we have secured our place in downtown Sandpoint. Anybody know what this building is? No cheating. Come on. 4th Street, 4th Avenue. It's right across from Magnolia, kind of. It's across from Sandpoint Psychotherapy. And those people are amazing. They do so much for people. The serious mental illness that Sandpoint Psychotherapy sees it's a lot. And so they'll be able to walk across the street and come in for the day after their appointment, hopefully, and stay for the day. It's a 5-room place with a kitchen, and it doesn't look that nice right now, but what does in Sandpoint, like at this time of year, okay? We're going to make it look really hot. Did we want a place before we actually launched our project? No, but this was on the spot bus route, and it was right across from where our members would hopefully be coming from. So we decided to snag it uninsulated and everything. Anyway, okay. So these are some of the I don't like this slide. It's so confusing the way it comes out on the screen. I'm very sorry, but basically our budget is going to be mainly for the executive director. So if anybody's interested in doing something like this, they can apply because we want them to be pretty amazing. They're going to have to be. They're going to have to do all of the coordinating and management as well as grant writing. So they've got a good job. The rest of it is all, administration and training and supplies and things like that. So the total is more like about 170 to 180,000. And then I don't know why you can't see this, but we do have some donations and grants already. We're already writing Innovia grants and Equinox grants and things like that. So we have some stuff coming in. But what we really need right now to launch our project is that ED salary and some staff and supply training stuff. So that's our number. This is our timeline. We're hoping to be open by the end of the summer, before the winter sets in. We'll see what happens with our grants and then go from there. So this is the big thing, is the people, place, and purpose and restoration of up to 3,900 people in the counties here. I'm going to let you ask questions because I'm sure you have a lot. This ties right in with NAMI's strategic plan to improve the lives of people that live with serious mental illness and their families. Big time. We couldn't do a crisis center here. That's going to take another couple of years, right, Joe? That's another thing that we need in this county. But for right now, this clubhouse really needs to get launched. We've got our NAMI support groups have members that need a clubhouse. I do the support groups. I help them and we sit around and talk, and I'm seeing family members completely overwhelmed with trying to rehab like a physical therapist would a broken arm, their loved ones, and it is killing them. I mean, it is not a good burden. They're underfinanced and they're underskilled to do this work. So let's take the burden off them and get this going.
All right, questions?
All right.
Wait, Kevin, I'm coming.
So as I try to take notes, it sounded like we have three different places. We got Sand Creek, we got Magnolia, and Sandpoint Psychotherapy. We got three different clubhouses.
No.
No. The difference, do you want?
Yeah, there's no clubhouse in Sandpoint currently. So I think what Don was probably referencing was different organizations that already exist that we're consulting with to help get ours off the ground. There's no clubhouse in Northern Idaho. I think the closest one's in Spokane.
There's no Clubhouse International in Idaho.
Yeah.
The difference is the amount of
Hi,
time
Don.
people can spend. Hello.
It's Randy. I just wanted to let you know I was here in case you wanted to touch on peer support, peer stuff. So
Let me
anyway, and
answer your
thank you
question.
for the forum to talk about this project because it's really exciting and it would be a huge boon.
Randy, can I ask you
for
to
people
pause?
in the area.
Randy, she's in the middle of answering a question.
I'll be right back with
Understood.
you, Randy. Thanks. Okay, so Sandpoint Psychotherapy, they have CBR. They've got community-based resource people that can come in and spend an hour and a half with your family member, maybe two. How long did they spend? Do we know?
So probably the two largest counseling services in Sandpoint Psychotherapy and Connexu. As far as outpatient mental health counseling, we used to have more in Sandpoint, and just if you look around the region, more and more places are closing than expanding due to cost, really is what it comes down to. So it started a handful of years ago with Sequel Alliance. I don't know if anybody remembers that organization that I think they closed maybe 4 years ago, and Kootenai's had their own struggles, and there's North Idaho Children's Mental Health closed maybe 2 years ago, ballpark. And so it's just harder and harder for organizations that service folks that have, primarily Medicare, Medicaid. And that's a whole separate conversation, but it's harder for those organizations to stay open. So the two big ones right now are Connexu and Sandpoint Psychotherapy, but they're not clubhouses.
So there are two questions that came in to me. One is there a faith-based arm in any of these options for treatment? And then the second one was, as we in the community recognize the void within our community, where should we go when we're having the problem in real time? Because that is, therapy appointments are far out oftentimes at some provider's office, but it doesn't change that the crisis can be right now, not an appointment to establish care in 90 days. With that cycle and mental health of, yes, you recognize you need the appointment, but making the appointment and being far out for regular continuous treatment. Because it's not like the broken arm. It doesn't get fixed. It's a condition that you're living with. There's not a magic surgery. It is
it's a great
continual treatment.
It's a great question.
And that might wrap us up even.
Okay, I'll let him answer that one, but back to you. 30 hours a week is different than a couple hours a week. And we'll be open on a couple nights and we'll have activities. It's a different thing. It's more of a club without the pool. There's no pool. It's a place where people can come for inclusion and to be connected with other people. The other ones, they may have support groups here and there, but nothing like this. And then as far as NAMI goes, we have support groups for families. We've got Randy leading our connections for the people that live with a mental illness. We have family education. We have peer education, all in NAMI. That's separate than the clubhouse, just to make all that straight. I'm trying to double dip here and talk to you about both. But so in the NAMI, this is a project under NAMI for a lot bigger thing than what we're offering now currently. And then as far as what to do in a crisis,
And
I don't know.
And faith-based.
Oh, faith-based. We do have faith-based really quick. Sorry. NAMI has a faith-based internet or a network that they actually have put together through NAMI Idaho. So if anybody's interested in that, they just need to either email me or get on the website or whatever you want to do and find me and I'll tell you about it. Okay.
Okay. To my knowledge, Sandpoint Psychotherapy doesn't have a branch or arm that's specifically faith-based, nor is Connexu a specifically faith-based organization or has a branch of it. That being said, I mean, just, I can answer for myself. I try to honor a person's both cultural and spiritual background. And so if they want to bring that into the counseling services, I'm happy to honor that experience. But we're not specifically, advertising as a faith-based organization. That being said, there are institutions and individuals in our community that absolutely do advertise as Christian-based or faith-based counselors. I can't recall off the top of my head. I know I've interfaced with a couple of folks, and my best advice is, if that is what you're looking for, contact the Envision Center, formerly the Community Resource Center, because I think probably better than any other institution, to my knowledge, in Sandpoint, they kind of try. That's one of their goals, is to keep tabs on all the different resources in our organization, the different therapists. It's a ever moving target, who has openings and who doesn't. So I wouldn't necessarily call them to say who's got availability, because that's always changing. But at least they can inform you about who's out there, what their practices are, who they take, things along those lines. Now, as far as responding into a crisis, it depends on what we're talking about here. So, I can answer broadly. The first thing I want to tell you is the National Suicide Hotline number changed the number a couple of years ago to make it easier, because it was this arbitrary number that nobody could remember. It's now 988, just like 911, but specifically for suicide prevention. So it's a number that everyone can remember, and share that with everyone you can think of. 988, the National Suicide Hotline. As far as accessing care, I actually might lean on Olivia, who's right behind Miss Williams right there, to help with patient navigation is kind of what I was thinking of as far as even if you can't see a therapist at that moment. And we are actually working on crisis appointments and things along those lines. I have a counterpart, her name's Shannon Tapana, and she's fantastic. She oversees our substance abuse and counseling department. And if she was here, she could, speak much more eloquently than someone that's been on staff for 10 days. But this is where Olivia can probably fill in some gaps.
Do you mean patient assistance?
I was thinking of like Denise,
Ah.
that. So like someone that interfaces right away with somebody.
Yeah, so at Connexu Community Health, we do have your first appointment when your new patient is going to be with a patient navigator. It's an hour-long appointment, and this is a chance for you to one-on-one talk to a staff member and figure out what are your specific needs, how can we tap you into those needs, whether they're within Connexu or they're out in the community, and get you the lay of the land so you know exactly what is available to you from the get-go. Does that answer it?
Yeah, and it's rapid. Like she interfaces, like I don't know what her timeline is, but this isn't one of those like I'll see you in a month kind of thing. It's
Yeah,
quick.
typically they happen within the 3 days of you calling.
Right. So this exact issue of like how do we get help faster? That's one of the things that we're working on because we recognize that, and it still doesn't necessarily mean I'm going to have you're not necessarily going to be able to sit down with a therapist or psychiatrist or psychiatric provider within a 24-hour window, but we're also working on addressing that issue. But we're trying to touch base, have some face-to-face contact right away for this issue. And if you have to, go to the hospital, right? Like if ultimately if safety is on the line and a person can't wait, go to the hospital.
All right, well, we've ended our time. I want to thank you guys for bringing a wealth of information.
Hey,
Our
Asia, can I
community. We've got
jump
a
in
lot
real
of
quick?
things to follow up on, but I want to also make sure everybody knows we have some, if you walked in, there's some behavioral health resources up here for you with some contact information and some NAMI brochures. But again, thank you guys for coming.
Thank you.
I know it was
Having us.
a lot
Asia,
doctors
Appreciate
provide.
it.
All right, technology has to switch it over. I'm sorry, Randy, I heard you, but we're over. Technology has to switch it over.